with Dr. Glossy today. I'm going to be handing over very soon to Bhavna Vedhara, who is the chairwoman at CII-IWN for the current year, and along with her, Dr. Glossy, the CII-IWN council or committee member, is with us today to take up your questions. Divya, if we can start going live now on Facebook. Okay, over to you, Bhavna.
Hi, thank you very much. Thanks, Rinki. And for those who don't know, Rinki is our immediate past chair. So thank you very much for that, Rinki. And she is such a support to us, as are all our past chairs in the executive committee. Everything that we're endeavoring to do at CII-IWN would not be possible without the fantastic, absolutely fantastic executive committee that I have and my vice chair, Zia Sani. Today is Friday, and today is day 4 of Need of the Hour. And Dr. Glossy, a big, big warm welcome to you, and also a big thank you. You have kicked off our series. You have made yourself available and accessible to us every single day, and we really, really are grateful to you for your time, for your energy, and for all your guidance. There are so many things going around right now, and I think with the enormous overload, I would say, of information, we have to sift through that which is credible, that which is just, we are being inundated with information, and we just don't know, where to even begin. So really appreciate your time, Dr. Glossy. Thank you.
Thank you so much, Bhavna, CII, thank you. I am going to miss my evening sessions with everyone. I've really enjoyed this little time out for me. It was really nice. Thank you so much for the opportunity to connect with everyone. I would not say a pleasure. It's not a pleasure to be in such a situation, but it is always nice. Yes, please.
Thank you, Dr. Glossy. Yeah, so for everyone joining in, Need of the Hour is a series that we do every day, Monday to Friday, 5:30 to 6, where we bring you experts, thought leaders, doctors, and bring you credible information that is going to remove some of the fear and hopefully help you during this COVID crisis. So Dr. Glossy, as we wait for all the questions to come in, and knowing that the same 3 or 4 questions are being asked every day, so we won't spend too much time on it, but just very quickly, if I can just ask you to go over sort of the 3 or 4 key questions. What do I do if I start feeling unwell? Let's just start with that very quickly, and so that we answer everybody's questions today.
Okay, so what do I do when you are feeling unwell? This is one thing which comes under the home care protocol. Bhavna, should we start with the home care protocol?
Yeah, so what do you do when you start feeling unwell? Just your home, you start feeling unwell. What do you do? What's the first thing you're going to do? Isolate, Yeah.
Absolutely, absolutely. So when we say home care protocol, we are going into the isolation protocol. You're going to do those 5 things. You're going to isolate yourself. You're not going to panic. You're going to check your fever. You're going to check your pulse oximeter. You're going to take a glass of water and call your doctor. So these are the 5 things that you're going to do in the isolation home care protocol, followed by calling your doctor.
Okay, great. And if a doctor is not available, what are the medicines that everybody needs to have in their home kit? We're not talking hoarding, guys. This is not about creating panic, but it is about just making sure that you need to have this stuff available to you, so that if you or a loved one starts feeling symptoms, at least you have something available.
Yeah.
What those are?
Absolutely. There are 2 boxes which you need to keep, as we discussed in our previous sessions. There are 2 boxes. One box is going to have thermometer, pulse oximeter, vitamin C, D, E, and zinc in it. So this is your one box, which is going to go inside with you as you are isolating. The other box you're going to take you're going to open it with your doctor's prescription. You're going to try to connect to your doctor. You will not have it unless the doctor understands your problem. And those medicines are ivermectin, doxycycline, and azithromycin. You are just going to keep one set. That's why, as Bhavna said, this is not hoarding of medicines. We are keeping one set. So that one box and one box. These 2 boxes you're going to keep as your medical home care kit for COVID-19.
Okay, great. Now, so when we say isolation, can you just clarify for everybody, what is the difference between isolation and quarantining?
So whenever somebody is feeling unwell or tested positive, or you've got corona in the house, what do? Now comes the home care protocols. We divide them broadly into two for the ease of simplification. One is isolation. That means the person who is tested positive goes in that one room, a well ventilated happy room, we call it, not like it's not a jail room for you to be there and locked up. So that is one room. Now the rest of the family comes in a quarantine category. What is quarantine? Basically, so that you people were in close contact to somebody who had tested positive or is highly suspected to be positive. So this quarantine protocol is very important to follow in the house, which is what you need to identify in your house, the members who are at high risk. So Bhavna, what do you think? Who would be at high risk? You need to unmute yourself. Who would you think would be a high risk person in your family?
Anybody who had comorbidities, age is a factor. Or anybody, if you have comorbidities, if you are
diabetic, all those things. Absolutely. So those people are your family high risk people. You need to really take care of them. If somebody has undergone surgery, cancer patients, all of those. So those are your people to be highlighted upon. Secondly, this quarantine group has to have one caregiver for the isolation person. Okay. One caregiver who is not from the high risk, who knows and can be in communication with the doctor and the isolated person. One caregiver identified has to be one person giving food from the outside only, one person giving medicines, one person taking the responsibility entirely of the outside communication with the inside person. So that one caregiver, high risk you have identified, you have to make sure this quarantine has to happen for 2 weeks. Why has we have come to this stage? Okay, somebody got positive in my family, that person is locked inside, the rest of the family is roaming around, going out, meeting people, oh my God, this is what happened. No, your quarantine period begins from the time your person has tested positive. But now they say even from the day they have had symptoms, because the test is taking about 2 days to come. So anybody who is tested positive from that day till 14 days, your family is in a quarantine period. You are going to limit meeting people. It's only essential services that will be allowed for you, like groceries coming in, that's it. Those things. For 14 days, you're not going to be allowing anybody, and you are going to make sure that everybody follows protocols in the house. Hand washing, social distancing, at least 3 feet amongst each other. If a person is high risk, then it has to be at least 6 feet. And you should try anybody not feeling well, your next set should be ready. One person is in one room, one COVID medicine set is being used, prepare the second one, keep that ready, because the effect can happen after 5 to 6 days of incubation. So this would be your quarantine family protocol. And the isolation protocol, we have already understood that this is what the isolation protocol is. Those 5 things that the isolated person is doing.
Right. Just very quickly, and we also discussed yesterday, if somebody tests positive on day 1 till day 7, they should group together.
Yes.
Yes, because if you stagger and you are diagnosed, or you get your positive result, then the grouping of people has to be week 1, week 2, right? So they
Absolutely. Absolutely.
Okay. Now, lastly, before we start taking the others questions, the audience questions, I have one question, because again, everybody's talking about beds are not available, oxygen is not available. So everybody now has ICU setups at home. So I want to understand from you, Glossy, that if people are feeling unwell, they've been checking their pulse oximeter and we're stable, then it starts heading to say below 94. And you can't, and maybe they're high risk or maybe they're lower risk, but whatever it is, and what does an home isolation setup look like? What does it really need to have? Does it need to have external monitoring by a nurse, or can home people do it for themselves, for their loved ones? Can you just illuminate what home care would look like for somebody?
Are we talking about the home ICU setup, or here we are talking about the home care setup?
Well, let's talk about both one by one.
Okay, so let's first talk about the home care, which we have already, we know. Now
we've covered.
We have covered it. The only thing is, the question mark comes, the oxygen concentrator, as you've rightly pointed out. What do I do? My pulse oximeter is showing now 94. Now comes the question that, okay, I've got 94. Now, where do I head from here?
Yeah, is it the concentrator? Is it the oxygen? There's so much, and people are running ragged. So what actually has to happen?
Now, when it is 94, firstly, there is nothing to worry when it's 94. So between 91, 92 to 95, all you need to do is that you need to be prone, and you have to make sure that your stomach is not getting compressed, because there is a division between the stomach and the abdomen and the lungs, which is called the diaphragm. So if your tummy gets compressed, you cannot breathe through the tummy. And what you want is that you want your stomach part going up and down so that your lungs can get proper oxygen, and you are prone. You will lie down prone for at least half an hour and then check your pulse oximeter. If it goes back to 95, 96, you're good to go. Don't worry. Just keep a close watch. You don't have to do anything about it.
Okay.
But if you feel that you are getting breathless.
One second, before wait, sorry. Does everybody, I mean, I don't know if can you just tell us in like 30 seconds what is prone so that people know?
Prone is when your chest is down on the bed. Okay? When your stomach is on the bed. Right? So prone would be ulta. Your stomach is on the bed, your chest is on the bed, and important part is you can put 2-3 pillows, raise up your chest, your pelvis, but the tummy should be, there should be a hand space between the tummy so that it can breathe. And you can just put a pillow and relax yourself, your head ulta karke. It will be totally comfortable for you to do it. The point
So you lie upside down, basically.
Yes.
You lie upside down, and you are putting a pillow, and that will enable the breath to go deeper.
Yes, and it will put less pressure on the lungs. So you are not putting pressure on the lungs, versus when you are lying down seedha bilkul, like supine, you're lying down with your face up. So now you are lying down with your face down towards the bed. Okay. Now the important part about this is that if you're lying like this, what is happening? Patients are calling me, 15 minutes I was lying prone, there's nothing happening. It's going to take time. It's not going to be like 15 minutes and prone and, oh, your oxygen has gone up, thank God I'm okay. No. It's going to take half an hour, 40 minutes, maybe an hour. So just try like that if you're comfortable. However, if you are not getting comfortable, you are feeling chest tightness, breathlessness, stop there. And that's the time you call up the doctor that, listen, I am feeling this uneasiness here. I've tried to relax myself. It's not happening. You monitor the pulse oximeter. If it goes further down, now we are talking about prone is not working, it's going further down, my symptoms are coming.
Yeah.
It goes 91, you call your caregiver, listen, I think you need to start looking for oxygen concentrator now. There is nothing to panic. So you get the oxygen concentrator, and then the oxygen concentrator gets in your room, and you start with the settings of the oxygen concentrator. That is,
and start with level with 1 liter, then 2 liters as and when. So
yes.
Do you say that, okay, now maybe this is no longer working and you need oxygen cylinder or hospitalization? At what stage would that be?
See, it'll give you time. It's not something that it is going to happen just at a flick overnight. Okay, it is going to happen slowly, but you have to be vigilant. So you have put at 1 liter you start, you will not, what is happening is people want oxygen to be 98. They are not happy with 93, 94. Even if their symptoms are not there, they're not happy. They want, it's not a score. You're not getting, a mark thing that I've got 99.4. No, it's not like that.
Okay.
So,
yes.
So 92, 93, 94, 95, it's okay. So you have to make sure that you start with the minimum setting first. You start with 1 liter. You check it, your pulse oximeter is good. You switch it off after some time. After some time, you don't have to. You are okay. That much oxygen support was enough. If it's not, you go from 1 to 2, 2.5, 3, 3.5. You go on and on and on and on. Okay, you're at number 4 liter right now. and your oxygen is dipping down from 91 to 90. You call
The
up.
trend is not being maintained.
Yes.
So the trend is, yeah.
It's going down, right? Now, when it's going down, that's the time to put your second button in that, okay, two people, your caregiver as well as your doctor must know that, listen, now it's going further down. The caregiver starts looking for the hospitals and the doctor also starts looking for the hospitals for the O2 beds. You don't need BiPAP. You don't need oxygen cylinder right now. You don't need anything right now. You just need O2 bed, which I'm sure 1 month or 3 weeks or 4 weeks down the line, it might get a little better when we have O2 beds, because it's no rocket science in developing O2 bed. It's just one vigilance in bed. And right now we are in crisis, but things should get better. We'll be having O2 beds. That is the only thing that needs to be done. Nothing else. You don't have to hoard your house with oxygen cylinders and start giving high pressure oxygen. That is even harmful. After all, it's a medicine. Oxygen is a treatment. It's not the oxygen that you get from the plants.
Right. Dr. Glossy, we are 18 minutes in, and I really do need to take all the questions, but okay, so let's just start.
Yeah.
With, 1 second. So
Let's get the questions.
Here we go. Is it better to wait for 8 weeks as opposed to 6 weeks after jab 1, or just get it done at 6 weeks, given that C19 is rife?
So if you have taken Covishield, the proposed period is 6 to 8 weeks. They have researched, said that 6 weeks is better, 7 weeks is better. It's the same. It's not that you take it at 6, 7 weeks versus 8 weeks or 10 weeks. But yes, 4 weeks versus after 6 weeks, the response of antibodies at 6 weeks and later was better versus 4 weeks.
Post recovery, what is the most important red flag to look for in terms of health? Are there any follow-up tests that need to be done?
When we have, as we've discussed yesterday as well, from head to toe, COVID is going to affect you, but it affects my intestines. It's okay. That's manageable. It affects my joints, my muscles, my body ache, my fever. I'm all fine with it, but it has affected my lungs, and it has put a scar in it. It has put a kind of some degree, even if it's 1%, it might leave that scar, which can lead to interstitial lung disease, which is a chronic pulmonary condition, a chronic lung disease. So what do we do for that? We do physiotherapy, we do yoga for lungs, we keep our nutrition very high, we keep our hydration very high, we keep our medicines intact, we are in touch with the doctor. We are not going to say we are totally fine and off to work. No, you're going to slowly, gradually step into life back.
Okay, great. And so test-wise, there's no test to be done.
See, there's nothing, because as you're recovering, when you are in your 14-day period, there'll be one set of tests in first week, one set of tests towards your recovery. So any which ways you are getting those tests done. And if there
can you wait? I'm just going to stop you. Can you just elaborate? What are the tests for week 1, week 2? Let's just.
So week 1, you are in week 1, day 5 and 6. Depending on your symptoms, for example, you've got a lot of cough, you've got dry cough or chest tightness or uneasiness, or your pulse oximeter is showing abnormal readings, you will then go for CT scan on day 5th or 6th. Along with that will be your baseline blood test, your complete blood count, your IL-6, your inflammatory markers, D-dimers, CRP, ESR, all of this are the inflammatory markers, ferritin and all, in our body, which are caused by viral infections. Nothing in particular by COVID. That's why we say that do not use these tests for diagnosis. So these are the baseline tests. The same set of tests, same CT scan, same blood test will be repeated in the second week. Now day will be decided by your doctor, whether it is day 11, 12, 13 or 14. So that is depending on your symptoms. These are the same set of tests. Now, depending on the second result that you are getting in the second week, will the follow-up test happen? Otherwise, usually there are no tests needed. There is absolutely no problem. So don't keep getting your tests yourself tested, especially for your CT scan. People are coming to me with 3 scans that, I've got my First scan done, it was mild, then it became severe, then it's not getting okay, then it's becoming moderate. Do not follow it up with CT scan. You are, after all, getting radiation also. Don't misuse it, okay?
Right. Glossy, just 1 second. Can I please request everybody who is joining us to please mute yourselves and turn your videos off, please? Thank you so much. Thank you, Glossy. So how long after your second jab do antibodies develop? And that's from Megha.
Okay, Megha, antibodies develop after about 4 weeks to 8 weeks, but please do not get your antibodies tested. It carries no meaning. So do not get your antibodies tested unless you want to donate plasma, which you cannot if you're vaccinated, unless you want to, give yourself psychological satisfaction that I have got antibodies, and that's what happened with everybody. And that's why, one of the many reasons why we are here in a pandemic. I've got vaccinated, I cannot have infection.
Yeah. So 2 questions from Rohit. Are we seeing vaccine shortages in India? And 2, are we weakened after jab 2, 14 days and at extra risk, or is the risk the same as after jab 1?
What risk? Okay, first part of the question, are we facing
vaccine shortages in India?
Yes. Now, I don't know whether it is vaccine shortage from the manufacturer side or whether it is from the government side. But yes, our hospitals have been told that the vaccine will come maybe a week later. We have been authorized to give in, but to be taken to purchase the vaccine from the government sources, but we are not able to because there is no vaccine available right now. The reason behind it, whether manufacturing or government, no idea.
We don't know. So yes, the answer is yes. Are we seeing vaccine shortages? Yes. Are we weakened after jab 2 for a period of 14 days or any extra risk?
No, okay. We are not.
Which days are most critical after one is diagnosed with COVID? 87 for my mom, and her fever has been 101 for the past 3 days consistently. Today, her O2 is 94, unlike 96, 97 for the past few days. Is that expected? She started steroids today. This is also from Megha.
Okay, so Megha, your first part of the question is that what day of the week, what day when you have tested positive? So let's count the day from the day of your symptoms and not from the day of your RT-PCR positive. The day of the symptom is the first day. From there, what we have usually seen in this 2021 virus is that the fever is persisting till day 11 also. And when I'm saying fever, it's high-grade fever, which is not responding to our simple crocin or paracetamol, and we have to give alternative medicines for this. Now, one is fever is persisting longer till day 11. What are the other symptoms that one should be really worried about? Day 8, 9, 10, 11 are the ones which patients are really getting troubled. The oxygen saturation is going a little down, so just hang on there. Fight it out. What we are observing, Bhavna, is that patients are giving up. They are not, being strong, what they were in 2020. They have given up, rightly so, because of so many, mortalities that we've got with 2021 virus, mutant strain. So you need to hang on there on day 8, 9, 10, 11. And post day 11, mostly we are seeing people recovering pretty well.
Okay, fine. This is from Namita. I got my COVID positive report 6 days back, but I'm on my 12th day since the first symptoms started, and fifth full day of COVID-related medication. So she's been on medicines for 5 days. My oxygen levels are 96 to 98, no other symptoms. My sense of smell is returning, but fever continues to be in the 99.5 range, sometimes touching 100. Is this something to worry about, and what should I do?
Nothing to worry about. You're recovering. Congratulations.
Wonderful. Now we talk to Radhika. Do you see any diabetes, heart, or BP patients having a clot problem with COVID?
No, I have not.
Okay.
And let me tell you, my family of 156 doctors, half of them have taken Covishield, and we are quite a lot and no complications. So good.
Wonderful. Okay, what is the difference between an oxygen cylinder and a concentrator? Is one better than the other? That's from Rinky.
So it's not that one better than the other. Rinky, concentrator gives you concentrated slow flow oxygen for you to sustain at home and control your oxygen at a, it won't give you any side effects. It's like a slow release oxygen being given to you, okay? Versus an oxygen cylinder, which should be in the hospital setup, which should not be ideally in the home setup, because what is happening is you tend to take high flow oxygen. When high flow oxygen goes in, it can sometimes goes into the outer space of the lungs and the outer space of the heart. We call it mediastinal emphysema. That means you've got oxygen toxicity. So that is where, and this is happening. Yesterday also I had discussed that I've seen cases. Today also,
Yes.
there were 4 cases of the same problem.
So people are almost, because they're so in such a panic state,
Yes.
that not only are they, I mean, okay, concentrator hai, nahi hai, chalo oxygen hi laga lo.
Exactly.
It's actually very detrimental to be doing this, right?
Absolutely. You should always keep the concentrator, as we have discussed how to use
Yeah.
it.
Okay.
And, look for the O2.
And look for the O2. Okay, then from Mitali, after 14 days, can one resume regular life and mix with the rest of the family members? Or need to get another test done first? I think we've talked about that. But 14 days, can one resume regular life and mix with other family members?
No. You are not going to be out there. I've got out of 14 day of my quarantine period and mix with everyone. High risk people need to be identified. People who have been exposed need to be identified. You have to maintain that 3 feet distance in the house from your high risk people. If you are meeting, wear a mask. For at least another a week, you are going to be very, very careful. You're going to go to work slowly, your exercise schedule slowly, you're back to normal life slowly, which might take a month. Don't rush into things.
Okay, thank you. Thank you.
Count your blessings that you're alive.
At least you're recovering.
Yeah.
Okay. Hi, doctor. This is from Kiana. We've just recovered from COVID. So after how many days after recovery can we take a corona vaccination?
So coronavirus vaccine, whichever one you are taking, the research says some are saying 4 weeks, some are saying 3 months. So anything between 4 weeks to 90 days after you are going to take it, the research will come more whether you can, 4 weeks is safer or not, but at least 4 weeks. You have to wait before you take your vaccine.
Okay. When can we say that a patient is truly on the road to recovery? This is from Anu Malhotra. Yeah.
I wish the answer was very simple. We have seen cases. You know, it's disappointing to say that, it's disheartening. I feel helpless, but cases have gone from mild to severe also, and cases have recovered also. The good part is that about 75% or 80% people are recovering.
Yeah.
But we are concerned about those 15 or 20% right now. So
True.
you cannot.
Okay, from Kiran, my helpers tested positive. When do they come back to work? If they test negative, can they rejoin for work? Do they have to, or do they just wait out their 2 weeks and then come back to work?
No, we need to follow the same protocol as for anybody else. I know they're your workers and you are helpless and you cannot do anything. It's not that you're going to let them in after 10 days. You have to start
14 days.
Yeah. So usually what is happening is after 10 days, people are letting them in. Cooking food yourself is not easy. Cleaning yourself is not easy. We all need helpers. We are so used to them. Get back to your own feet, guys. We need to do it ourselves. You have to maintain that 14-day off quarantine period strictly. You have to make sure complete medications are done. And depending on the person's further symptoms, you're going to then advise. If somebody has cough, then after 14 days also, you are going to make sure that the person is wearing mask, especially in front of the high-risk people when they are in contact.
So basically, in a nutshell, Glossy, so they can return after 14 days, assuming they are better, right?
Yes.
And if somebody was asymptomatic, then do they still return to work after 14 days? Would that be the right rule of thumb?
Yes. Whether you are symptomatic, asymptomatic, after 14 days, you'll return to work. but you have to make sure that your medications are properly intact, not that you have not taken and
Yeah.
you're complicated. Yeah.
Okay. From Malika, when can one exercise or walk post-COVID recovery?
Walk you can do anytime. That's a regular thing. But
Yeah.
exercise, when you're talking about exercise, the high intensity HIIT exercises, please don't do it for at least
Yeah.
a month. Go slow on your body. Do not go on treadmill or running or jogging. Do not do any cardio for at least a month. Go slow on walking. Walking, I would just say go slow on your cardio.
Okay. From Megha, can one resume light workout immediately after the second jab?
Of course, workout
Okay.
is perfect. Yeah.
So from Kiana, hi doctor, we've just recovered. After how many days recovery can we take corona vaccination? I think
We've already answered that.
Yeah. Okay. My mill tested, this is from Pranita. My mill tested positive twice on the rapid antigen test while we await the RT-PCR. For the rest of us, as in the father-in-law, husband, kids, and help, have tested negative. While she's in isolation and we have moved to our other house, what other precautions would you recommend? She's got both her jabs.
See, now this is again that protocol of isolation versus quarantine. You might shift the place. You have moved out to another house, but you still need to be in quarantine for 14 days, not meeting other people. All right, your quarantine has to be the same quarantine because you all were exposed to this person who is in isolation. Even if you move places, if you're carrying the virus with you, it will go to other house also with you. So you have to make sure your quarantine is there for 14 days and observe for symptoms.
So I think what is really at the essence here is your own isolation if you are positive, but quarantining everybody in the family, everybody in the house because of the exposure to a person who's COVID positive, even if, right?
Absolutely. Spot on.
From Kiana, doctor, it's been 90 days, but my cough is not going. Is there, and it's there with mucus. So do I need to worry or is it okay?
Post-COVID cough with phlegm, without phlegm, it is happening. It's very common. What you need to see is how was your CT score, whether it was in the mild category or moderate category, and if it was not done, get an HRCT chest done. And depending on that, you need to see whether it is active COVID lesions or whether these are the healing fibrosis lesions. Plus, you need to do the post-COVID physiotherapy for lungs. Otherwise, the cough is really troublesome.
Okay. Thanks, Dr. Glossy. Can I just request everybody to please turn their cameras and off and please mute yourselves. From Ani, if someone is asymptomatic and there's no cough, is the chest scan still necessary?
The chest scan is necessary only if you have some symptom. So if you have some symptom, your RT-PCR is turning out negative, then that's the time that you do an HRCT chest. But if you don't have symptoms, your RT-PCR is negative, hang on for 7 days, observe yourself, plus 3 days totally asymptomatic and you are out, you don't need any test.
Okay, wonderful, thank you. From Sonil, if all members are down with COVID one by one, start finishing their 14-day period while others are still positive, step out of the house.
See, nobody should step out of the house until the time the last person in the house has completed 14 days, assuming that all of them have been treated successfully, no hospitalization, no complication.
Okay, so it's really, so it's not that one person is now better, 14 days uske ho gaye, and the next person, but no. And you tested positive later. So the staggered, but that means the first person and say the fifth person who tested positive, that means somebody may have to well stay in the house for 6 weeks.
Absolutely. And that is what people haven't done. And that is one of the reasons why we are here, Bhavna, where we are.
Right. Okay, that's very good. It's a very good clarification, actually. Megha, my brother was negative, but his wife was tested positive. He had rash, no other symptoms. It's day 11. He has high fever. SPO is 97. What do you do in this situation?
It's a mild case. Just keep your same crocin. If it's not going, we give Meftal Fort. And that's it. We continue doing the same things and hang on. Day 11,
Okay.
day 12, 13 should be fine.
Great. From Anu, if one family member tests positive, in how many days can the other members show symptoms if they are also infected? That's a very good question. Yeah, because
Yeah, it's a domino effect, what we call it. So usually the incubation period of coronavirus, what we have seen in 2021, is about 5 to 7 days. So you need to observe for 5 to 7 days for any symptom to develop. And if, say, for example, from day 1 of that first person symptom till day 7th, nobody has got a symptom in the house, that means it's relatively safe.
okay. From Pranita, what is your opinion on ordering food from outside?
Please don't order, cook at home.
Okay. Sahiba, can you get fever after 12 days of the first vaccine? Should the patient be tested? So I think Sahiba's question might be, is it vaccine related, the fever? Or is it...
See, getting fever after 12 days of jab is quite unlikely. What you usually get is 48 hours. Within 48 hours, you get fever if it's vaccine related. Quite unlikely that it's vaccine related. So better to get the same protocol, isolate and check yourself.
Okay, from Namrata, my 4 staff members tested positive. They are in quarantine together. One who tested positive first, after 14 days of his test.
I'm sorry.
Yeah. My 4 staff members tested positive. They are in quarantine together. I'll just rephrase this. Basically, the first person who tested positive, can he come back into the house after 14 days of his original test result and without retesting him again? Can she bring him down? That's her question.
Okay, now 1, 2, 3, 4 people in one room quarantine, right? One tested positive first, but was also exposed to the second staff tested some like little later, right? And third
Probably.
staff, yeah, probably.
Yeah.
So they were not all tested together. So see, if you've put them in one room, then you have to wait till the last person's 14th day ends.
Okay.
And they are asymptomatic. And there is absolutely no need of getting a repeat RT-PCR after 14 days, guys, because it's putting extra pressure on the labs. It's absolutely not needed because RT-PCR also picks up dead virus. It can still come positive.
Right. So basically, after 14 days, I think what is key to understand is if you are asymptomatic, if you have had your 14 days, you've done your treatment and now you're done, 14 days later, you are no longer contagious to other people.
Absolutely.
Yeah, so that's the real takeaway, that after 14 days, asymptomatic, then you are no longer contagious, you can go out. And of course, we have to keep in mind the staggered effect from the last day of the last person showing having that symptoms.
Yeah.
Okay.
If they are in the same room.
Yeah. Okay. Then from Rohit, I have heard that ivermectin is not really used overseas. Is this true? Why are we using it in India? Please clarify.
See, the problem is that the fact remains that we have no medicine to treat COVID-19, pneumonia, and pneumonitis. We started with hydroxychloroquine. We came to anti-parasitic drug, which is ivermectin. It is used to treat parasitic infections. And we tried it to treat viral infection. It showed that, okay, maybe the results are good, but it has no side effects. Then we kept on adding medicines. There is no medicine to treat. Some people will recover even if they are not taking, and some won't recover even if they are taking. So it is country-wise, they have made the protocols, but what we follow is what is safe to use and might be useful in our patients. And it has actually been useful to some extent, but yes, cases have gone bad also despite taking ivermectin.
Okay, so ivermectin is basically also from, I guess the question being that India, we are using it and we found it to have some success, which is why we're, further strain or whatever.
We hope so that things get, yeah.
Okay, then from Prem, we've got, how does one travel on a flight and ensure he doesn't catch COVID? What can be done to limit exposures on flights?
You stay at home and do not take flight. Simple as that.
Yeah, so don't travel as best as you can. Okay. Another one from Prem. Can one drink alcohol after the first and second jab, or will it interfere in the efficacy of the jab? If so, after how long after the jab can one have alcohol for leisure?
See what alcohol does. Basically, it reduces your immune response. So if you're getting a vaccine, your body is supposed to produce antibodies against the virus, right? So if you are suppressing that response, so instead of getting good amount of antibodies, you might get less amount of antibodies. So in this viral condition, we want more protection, right? So
Yeah.
leave alcohol for 2 weeks at least. That's what I say. But some docs don't agree to that, and they say, "Oh, forget it. Have a glass of wine and sleep over it." But it's entirely it's entirely under research.
It's doctor dependent, right?
It's doctor dependence.
If your doctor lets you have the alcohol. Okay.
Yes.
Wonderful. Can I request everybody to turn their cameras off and put themselves on mute? So I know that Dr. Glossy, we have gone over. We're almost done with our questions. How is this strain different from the earlier strain?
It's a mutant strain. That does not mean that the virus has changed. It's just that the viruses have the capability, they are very intelligent, that they change their structure like a minute part in it, they change, and that can go either ways. It can become docile, it can become very virulent. So in this, it has become more contagious. So this one has become more contagious than what it was in 2020.
Okay. Dr. Glossy, just one more question before we wrap up, which was that, we talked a little bit about home isolation at the start. There you said that we now people are making these home, ICU sort of set up at home. Can you just tell us what are the things that we need to have at home, do's and don'ts? So if people are being monitored in home ICU setups, what is it that we must look into?
See, Bhavna, in current scenario that we are in, if I talk about today, yes, home ICU is a better way to do a setup because the hospital beds are not available, doctors are not available. But there are hospitals who have created the system of setting up home ICU. The whole team comes and sets it up for you. The home ICU is not something that you can go to the market and pick it up and make your own home ICU. No, you need medical guidance for that. It needs a ventilator, it needs a DVT pump, it needs a BiPAP machine, it needs a cardiac monitor. There are list of 10-20 things which you will buy under medical supervision. It's not something that you go to the shop and pick it up. You can't do that. You need trained medical nurse for that. So that nurse will 24-hour monitor the home ICU for you, and the ICU specialist will come and visit it periodically as and when needed. So but this is a very good option. If this is how our country is going to be right now, then it's better that government comes up with the home ICU protocols. It will be a big hit for us. It'll be good if we can do.
So just a quick question on this. So who are the people who are the right candidates for home ICU? The reason I ask that is somebody maybe with no comorbidities, they might be suitable. Like, for example, maybe they need it, but older, maybe where they have the potential of going south very quickly. Maybe they need a super specialty. I don't know. Can you shed some light on that?
Yeah, so who would need a home ICU? We cannot be 100% sure.
Who's a better candidate?
Yes, who's a better candidate? Anybody who has comorbidities. If somebody, for example, is a cancer survivor, he or she would need. If somebody has diabetes and other conditions, see, only you having diabetes doesn't put you under high risk that you put a home ICU setup. You are trying, okay, and you have fought with the disease for a week and you have deteriorated. You've become breathless to the level that the doc said, listen, you need a BiPAP. When the doc says you need a BiPAP, you are the candidate, whether you are in your 20s, 30s, 40s, 50s, or whether you have comorbidities or no comorbidities. So it all depends from symptoms to symptoms, Bhavna. These days we have got very young people in ICU with us. So it's unfortunate,
Okay, and I think you've already answered this, but is it advisable to invest in an oxygen concentrator?
See, the best part, what we have done in our community here, share it. Like the whole community can club to get, say about, depending on what is the population of your community, you take 5 concentrators. Anybody who's, and that person who's handling the concentrator thing, the group of people, like 5, 6 of them can manage that. Whosoever needs it, they take it for about 10 days or 1 week. Maximum you would need a concentrator is for 1 week. If you're not recovering, you would anyways end up in the hospital. So use it for 1 week, give it back, and then somebody else uses it. There is no point everybody starts keeping concentrators at home. There's no point.
Right. Okay, on that wonderful note, and we've done that very successfully in Vasant Vihar, so I can just say that here.
Yes.
Glossy and I. So everyone, thank you very much for joining us. Dr. Glossy, so much. All 4 days have been very, very informative. And, you know, having this live interaction, giving them access to an amazing doctor and letting everybody, you know, sharing your insights, answering everybody's questions live, you know, has been just wonderful. Thank you so much. CII-IWN, we really are in gratitude to you.
Thank you, Bhavna. I remember when you first spoke to me about this, that, you know, it's better to do this live, and I was like, really? Do you think people are going to turn up and ask questions? Really? I was in 2 minds. I said, I think I can just speak up like that. And she said, stop it. Don't give those lectures. Everybody can open up YouTube and listen to it. Do live. So I am myself. I enjoyed each and every session, and I hope you all enjoyed and benefited from it. I might not be able to answer the, you know, all the questions that you are putting, but I think we must have covered most of them. Still, if there are any, please ask us anytime.
You've done a fantastic job, Dr. Glossy. Thank you. And thank you not only as a doctor, as a friend. She's also on my executive committee at CII-IWN. So I'm very privileged to have her in that role as well. And thank you so much. So now everybody, please do join us Monday to Friday, 5:30 to 6. We will be going live with doctors, thought leaders, experts, field experts, and we will be bringing you relevant, credible information. So Monday, we are kicking off with Dr. Suhaila Kapoor, and we'll be discussing COVID and the brain, the impact on your brain. So please tune in again, Monday, 5:30, right on the same link that we've shared with everybody. Thank you so much, Dr. Glossy, and thank you everyone for joining in.
Thank you so much. Thank you, Bhavna. Thank you, Glossy, for this wonderful session.